Good morning everybody and welcome to my blog spot. I'm Vince Colley from Measure Up Personal Training. And guys, what I want to do now, I want to do a series of video blogs and basically going through the basics, the things that we should be doing before we start training. And one of the very first things you should be doing if you haven't already done is going to a doctor, or if you've got a blood pressure gauge at home, get your blood pressure checked. And the other thing you need to do is get a blood test done so you can check for your cholesterol and sugar levels. So there are a couple of things that you should do, and with the blood test, that should be something you do probably every 12 or so months so you can keep an eye on things and see where you're at. Alright, well, one of the very first things I do with all my clients is teaching people to breathe properly, which is really important to do when you're training, and also activating our transverse abdominals, which is our belt, and helps keeping our lower back strong. Now, one of the very first things I do is called a tummy tuck. Now, to do tummy tucks, we get on all fours. We have our hands in line with our shoulders and our knees in line with our hips. Okay, so for example, you wouldn't have your hands out like that. We wouldn't have your knees out like that. We get into a position, as I said, hands in line with the shoulders and knees in line with the hips. Now, always looking down at the ground. We don't want to be bringing our neck up because we are then straining through our neck. Okay, so we want to always keep it in a neutral position. And always think, guys, if ever you're feeling a strain through your neck, generally it's because it's not in a neutral position. So we're looking down. Now, as we breathe in, we let our tummy come out, okay, which is the opposite to what most people do. So we breathe out, our tummy falls out towards the ground. As you breathe in, you gently pull your belly button into your spine and imagine you're stopping the flow of pee or the flow of urine, whichever you can think or whichever relates to you. For me, it's the pee, and that actually rhymes. So what we're doing is we're breathing in, tummy comes out, breathing out, button in, stop the flow of pee. Breathing in, tummy comes out, breathing out, pull the belly button in and gently stop the flow of pee. Breathing in, tummy comes out. Breathing out, button in, stop the flow of pee. So we're activating those transverse abdominals. Now, you can do, 10, 15, 20 reps, doesn't matter. Try doing them at least once a day. The other thing is to activate your transverse abdominals, you can do that anywhere. Sitting at your desk, driving a car, whatever you're doing. Basically it's gently pull the belly button into the spine, stop the flow of pee and activate it and hold it there for 3 to 5 seconds and hold it. Start training it, start using it, get used to feeling it. The other thing is too, with that breathing technique that I've just shown you, as you breathe in, let your tummy come out, as you breathe out, button and stop the pee. Whenever you're moving any weight, wherever you're pushing, squatting, whenever you're moving the weight, that's when you want to be exhaling and activating your transverse abdominals, okay? And we'll talk about those sorts of things when I show you some training techniques and things like that. But the key is, remember, as you breathe in, tummy comes out. As you breathe out, gently pull the button into the spine, stop the flow of pee. I hope you found that useful. If you have any questions or anything, post them up on my blog and I'll answer them for you through my video blog. But until we meet again, this is Vince signing off. Have a great day. Bye for now.